Thank you, Linda. Thank you for joining us after lunch and for leaving the cake behind. And thank you to those of us joining online. I hope you had your own cake. So I'm going to talk today about an online open course in digital health that I worked on with some colleagues at Queen Mary University of London, including Professor Chie Adachi here, and also Ancient University in Cairo.
Happy to write that, or do you
Yeah, no, that's fine. So the project we worked with was a transnational education project. So I want to start by talking about why that transnational approach was so important for this project. And then I'll take you through a little bit of what we did, how we did it, and what we learned along the way, which is always the bit that people are interested in. So transnational education is, it has a lot of benefits. It allows students to benefit from the different resources, perspectives, areas of expertise of multiple organisations and institutions. It supports cross-cultural learning and collaboration, that bringing together different perspectives, ideas and ways of thinking that we know is so important in this interconnected and global world. Okay, and really importantly, transnational education widens access to quality education. As we've talked about quite a few times over the last few days, one of the UN's Sustainable Development Goals, and something that we're all here to promote. And from a slightly selfish perspective, it also facilitates capacity building, practice sharing and learning between institutions. So we all benefit from these projects. So our particular collaboration was between our team at Queen Mary University of London with Ancient University in Cairo. And we're quite different in some ways, but also very similar in some ways. Two world-class, top-ranked medical schools, both with a lot of history in our respective contexts. The medical school at Queen Mary is 900 years old. Ancient is one of Egypt's oldest medical schools as well, and both universities have a real equity and inclusion focus. So for Queen Mary, our vision is to open the doors of opportunity for all, and Ancient is all about regional leadership and global partnership to improve community health. So that real connection to our local communities. So our goals in this particular project were to widen participation in digital health education in Egypt, across Africa and across the globe. And we also really wanted to promote critical engagement and learning, professional learning in terms of digital health, which is something, it's a growing area of practice. It's incredibly important. It influences how each and every one of us in our interactions with health systems and our health practitioners. But it's not currently included in the core curriculum of medical courses. So there's medical students and there's healthcare practitioners and professionals who really are calling out for this kind of learning. So we wanted to achieve these goals through the co-creation of a free online course on digital health, and we were lucky enough to get some funding from the British Council as part of their Global Partnerships grant for that. So to create this course, we built on the triple helix model of innovation, where we were bringing together two universities that government support and connection and industry, working with the NHS, with the health system in Egypt, and also one of our lead educators has a lot of experience working with the World Health Organization as well. So lots of different perspectives and groups coming together there. And we had a range of ways of working together. We had a couple of in-person visits where we could really focus on setting the groundwork for the partnership, building the relationships, so thinking about the learning design workshop. What kind of course are we going to create? What is our focus here, our priorities? What kind of experience is important here? And doing the stuff that has to be done in person, or is better done in person, the filming of videos and interviews. We had fortnightly online meetings. Somehow we managed to get most of the project team into a meeting each fortnight, where we could talk through the operations and the logistics, the planning, making sure we were all on track, but also doing that problem solving that needed to be done along the way as you come up against those inevitable questions and challenges and things maybe not working quite as we had initially hoped. And of course, lots of asynchronous work, the writing, activity creation, building the course, testing along the way. And when we were thinking about designing this course, well, we're very aware, we're designing for global learners here. We've got a really diverse group of learners with lots of different areas of expertise, different levels of experience. We've got medical students, we've got people who are working as clinicians, as doctors in healthcare organisations. We've got people who are just interested in digital health and thinking about it as patients, as clients. Lots of different interests and lots of different contexts, cultural context, workplace context, national contexts. So we really wanted to focus on social learning and connectivism, being able to draw those different ideas together and for learners to be able to, we talked about co-MOOCs this one, to really contribute and be part of that learning experience and what they were getting out of it. We also drew on the community of inquiry framework, thinking about teacher presence, cognitive presence, and social presence, and really focus on active learning, reflection, and application, so that learners were able to think about what does this mean in my context? What does this mean for me? How do I apply it? How does it matter? So what we did was bring together expert voices. We've got some of our lead educators here, Hola, Professor Brooke, Joe, and also some people sharing their practice, people from the NHS. We've got a clinician here who also did some work around developing apps using AI for treating strokes. We've got an entrepreneur who came in from a computer science, software and programming background, who had an idea about this is something I could do that would feed in and improve healthcare practice, and was able to work with healthcare organisations to develop that. So able to share those stories and bring those voices to the fore, but also incorporate learner voices. So lots of discussion activities and opportunities to share, talk about what these ideas meant in their own context. What were the key things that mattered for them? How might they apply this? And get feedback and encouragement, ideas from both the educators and from each other. And we wanted to, as I said, focus on that reflection, application and planning. So it was a very active course. We've got an example here of a panel that we created for an activity in which people were practicing their telemedicine practice in whatever context that made sense for them, whether that was collaborating online with their colleagues, whether it was consulting with patients, being able to share that, and that fed into their digital health professional practice plan, which they were working on throughout the 4 weeks of the course, reflecting on their current context, their current practice, things that they might try and draw on, and their plans for the future. And also opportunities to test their learning and understanding as we went. But I think the professional practice plan was particularly popular with students. So in terms of our learner engagement so far, this started as a couple of weeks old, so it's now out of date. I think we're now up to about 2,700, nearly 2,800 learners from 106 countries. I'm pretty sure that went up. More than 800 from Egypt, about 400 from Nigeria, and nearly 400 from here in the UK. We've got a completion rate of 14.5%, which, as MOOCs go, we're actually pretty happy with. The certificates are now up to about 110, I believe. So we had free certificates that were available to medical students at ASU and Queen Mary, but then also the opportunity for learners who had done the course and wanted to be able to provide that certification, that verification of learning, could purchase the certificate. So what did they think? Well, we had 92% who told us that the course was a good learning experience. What I was really excited about was the 85% who thought that they'd be able to learn use what they learned in the course, and 91% who would recommend the course to others. The two down the bottom here, these are some early numbers, because we've done a pre-course survey and a post-course survey. At the moment, we've got about 4 times as many who've done the pre-course survey as who've actually got through and finished the post-course survey. So we do need to take these with a bit of grain of salt. But we've got 94% who, following the course, said that they feel knowledgeable about digital health and its potential impacts on their practice, and 86% who feel confident about digital health and their ability to incorporate it. So the pre-course survey number for the confidence was 44%. That's why we need to be careful, because the ones who finished, we don't know. Sat within that 44%, were they more confident to begin with, but yeah, final data will be coming soonish. Some of the comments from students, what they really liked was being able to take the information, learn about digital health in their own time, that it was accessible, easy to understand, and getting to hear from the professors on the course. The sharing of ideas in the discussion section, the feedback from instructors, hearing the different voices, the different invited speakers, and the different stories and experiences, the different areas of expertise they were able to share. And I think this one is my favourite quote. A learner in Kenya who, even though they were quite far away from the educators in Egypt or in London, but being able to learn from them, and more importantly, changing the way that they viewed healthcare there in Kenya and what they could start preparing for and integrating into their health system. Of course, it wasn't just the learners who learned, we learned lots as well, and we learned that we were better together. We were more than the sum of our parts. By coming together, we were able to extend that knowledge, our learning, to put together a course that was better than either of us could have done by ourselves. Open communication was key to our success. There were lots of different perspectives and different ways of doing things, different ideas about how we might approach things along the way. And by employing those open channels of conversation, those regular catch-ups, we were able to negotiate, to talk through how we might approach things. One example of that was around the pricing of the certificates, and what seems like a reasonable cost in the UK based on how Future Learn, for example, might price the certificates, was really going to put those certificates out of reach for many healthcare professionals in Egypt, let alone in some other countries in Africa. So being able to take that into account and think about, okay, how do we do this in a way that makes it more accessible? Developing a shared goal and shared language, that understanding of what is it that we want to achieve here was it was important to do that early on, particularly given the different national and cultural contexts. And we needed to accept some uncertainty along the way, finding out things that weren't necessarily going to work as we had initially planned. Some of that was about enrollments, payments, and how the different platforms work. And identifying the things that were not negotiable for us. What did we think the learners had to get out of this, and focusing our energies on making sure those things were in the course, and the rest, you know, we lived with some things. So I hope now that I've kind of convinced you that this is a good thing to try. Very happy to have questions. And also if you'd like to check out our course, it is free, and you can access it through the QR.